Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor and mother who has hand-selected experts in natural, holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today's episode, I have the pleasure of interviewing my friend Debra Goldman, who's a pelvic floor physical therapist. And we're speaking on the topic of creating a proactive approach to your health during pregnancy, childbirth, and postpartum recovery. Debra began her career as a modern dancer in New York City, but after a couple dance-related injuries, she shifted her focus to the field of dance and sports medicine and earned a BS in physical therapy from Northwestern University's Feinberg School of Medicine. Debra then returned to Manhattan, and for 12 years, she worked at orthopedic and sports medicine clinics in the financial district. She also created a practice with a focus on prenatal and postpartum issues located in New York's only freestanding midwifery-run childbearing center. That experience led Debra to immerse herself in her specialty in true professional passion, healing pelvic floor dysfunction. In 2004, she launched Four Corners Physical Therapy in Florham Park, New Jersey, where she is dedicated to delivering skilled hands-on treatment and functional strengthening and movement to help support women's bodies through pregnancy, postpartum, perimenopause, and menopause. She's also a master teacher of the Alexander Technique and has dedicated years of study and practice to osteopathic manual medicine. Her own experience as she navigated conception, recurrent miscarriage, fertility treatment, and birth to her son Jack at age 41 inspire her dedication to trauma-informed care. Hi, Debra. Welcome to the show. I'm very excited to have you on today.
Hi, Laura. I'm so happy to have this opportunity. I'm super excited.
I'm so excited too. So we connected a few weeks ago because I was in need of some pelvic physical therapy. I'm out in the burbs now, and your practice is fairly conveniently located to my new home. And I'm just so glad we connected. This has just been really not only so helpful for me personally, but I'm just excited to have you on as a guest and for you to share your years of wisdom around empowering women. Yeah. So let's start off with talking a little bit about why you're so passionate about, having women be proactive and educated and empowered as they're going through pregnancy and birth.
Well, I've been a physical therapist for 30 years, and I started out in sports medicine and orthopedics, but pretty soon after developed an interest in women's health, especially the perinatal population. And then I got pregnant, and I went through fertility treatments and all kinds of interventions, and then had a successful pregnancy and at 41, and I was incorporating some of my interest in the orthopedic sports medicine practice. And then I moved away from that and started a small private practice in Manhattan's only freestanding childbirth center. That was on 14th Street in the West Village. That was called the Elizabeth Seton Childbearing Center. And it was like this whole other world opened up to me, because now I was interacting with midwives and doulas and other birth professionals. And it was such a unique situation. It was like really a very holistic, all-in-one, very inclusive place. And at that point, I started to, I was seeing pregnant patients. I was seeing other people in the neighborhood as well, but I started to realize that I was missing something. And I was missing, and this was back in like 2000 or yeah, it was back in 2000. So I kind of heard about pelvic floor therapy, but I hadn't invested in it yet. And then a number of things happened, and my family moved to Montclair, New Jersey, and I started practicing on my own. And I got in touch with a local urogynecologist who then kind of pulled me into, he actually helped me kind of realize that the pelvic floor was what I was missing, my pelvic floor. And so I just began to dive into continuing education, and my professional organization offered, the two master teachers who are now mostly retired, but I was kind of that second wave. There was an earlier wave before me, and I just became so passionate and so interested in helping women in this part of their life, that things that women just didn't, we don't talk about. So that included some, bladder issues, pelvic pain, pregnancy related issues, postpartum. So I started really dedicating, and I created my Four Corners Physical Therapy LLC in 2004. And then I just started to strike out on my own. And I just immediately had an incredible intake of patients in the area who were looking for that kind of help. I think that it almost seems like that was a very long time ago, but you know, it was almost, I guess in a way, it was almost 20 years ago. So there weren't that many physical therapists who were really doing this kind of work. And because I think also because of the struggles that I went through when I was, dealing with miscarriage and fertility and not knowing. And back then it wasn't really, social media wasn't a thing. So it was very isolating. So I think that I really was devoted to trying to inform as many women as I could about the possibilities of getting help during this time.
Right.
And
So
that
how did
really,
you reach
mhm.
those women? I mean, in 2004, maybe it was easier, is what you're saying.
um, you know, it it wasn't it it wasn't it wasn't as easy as it is now, because there wasn't Instagram and Facebook the same way. So but it just became word of mouth. I also really tried to connect with a lot of OBGYNs and other and chiropractors and birth doulas, and really reaching out to those communities. And then it became a lot of and midwives, and then it just started building. And then my practice kept growing. So I started out in a tiny little windowless room in a chiropractor's office in Clifton, and I was there for 3 years. And then I moved to a bigger space, in my own space in Verona, for 4 years. And then I found my space in Florham Park, and I was in a chiropractor's office for 8 years. So that was also a very holistic center, and they were very involved in prenatal and postpartum work as well. And then for the past 4 years, I've been in my own space in the same complex. And, it's been so I've really developed a lot of word of mouth recognition. And over those almost 20 years, I mean, I go to all the professional conferences that I could. So I meet my peers. I'm known by my peers. I make connections with other practitioners in who are interested in perinatal and postpartum and pelvic pain issues. And it's something that I just feel like it was my calling. Like, this is what I was really looking for, and it's just been so satisfying. And so I just continue on and love every opportunity to meet new patients, because every patient I learn something from, and they teach me something.
Yeah, it's fascinating. Even like a symptom of urinary incontinence could have multiple causes and need different types of treatment. So I think that's what's interesting. And I would say that would apply to patients I'm seeing as well with just musculoskeletal imbalances. There's not like a one size fits all fix, right?
Definitely. And I think for the past 20 years, I've been trying to educate physicians about the idea that all of these issues about, that relate to, like, the bladder, the bowel, sexual health, they all have a muscular skeletal component. So, but they tend to put it in a box, and then not and just kind of see the organs and don't see it
Right.
as, they see it as an organ system, and then they don't see it as a full body system. And I think that that's really the missing link that is helping women more than ever, like someone who, like us, who can really integrate those
Connect
ideas and
it.
help them.
Yeah, I mean, I see that when I have, like organic symptoms resolve, and I'm not here treating digestive issues, so to speak, or elimination or whatever. But, for me, it's about taking stress off the nervous system so the computer of the body is communicating properly. And to your point, all those organs have nerve innervation and as well as muscle connections. So they have to be addressed. And if there's imbalances there, it's going to create dysfunction.
Definitely. And I think also looking at the central nervous system as part of the big picture. And, we're all so stressed. And so helping patients, down train their central nervous system is such a huge, huge component. I mean, I generally always start with, when I'm seeing a patient, like just having them observe their own breathing, giving them the space to just lie on the table or sit or whatever it takes and just observe your own breathing, and then integrate that into diaphragmatic breathing, and then someone's ready to be evaluated. But to give people the space and to get in touch with their nervous system, I think is so
Ah,
critical.
that is just so powerful. I mean, I was at a conference last weekend, and essentially the big takeaway I got out of it is that I'm an applied neurologist.
Hmm.
And my job is to tone the nervous system.
Yeah.
And to your point, 99% of people, even children, are overly sympathetic, fight or flight, and that's not a healthy place to stay. And their parasympathetic or rest and digest nervous system is compromised. And when we balance these two parts of the nervous system, that's where we create health. And that's our jobs, right? To help tone the nervous system so it can have normal function.
Right. I mean, this is not an original statement, but one of my colleagues often says, when I'm doing manual therapy on someone, I'm having a conversation with your nervous system. It's not necessarily the joint mobilization or the soft tissue work that's thing. It's that it's evoking a connection between the peripheral and central nervous system. And that's what's evoking change. And I truly believe that.
I truly believe that too. That's where healing occurs, right? So I think that's really important for people to understand. So I think bottom line, we're both hands-on body workers.
Hmm.
And we
Exactly.
both are neuromusculoskeletal specialists, and we're non-invasive, and we're drug and surgery free, and we're the first place for, in my mind, for women to receive a lot of benefits, physically, mentally, emotionally, and then spiritually, right? And therefore perhaps not needing to go to take drugs or to have surgery.
Right. And I think it's also, I mean, I encourage my patients, so I often tell them it's like, it's not just me who's going to help you with this. You might need acupuncture, chiropractic, like
Yeah, the team
find the
approach.
things. The team approach is really the strongest approach.
It
And
really
then
is. Go
and
ahead.
then them taking responsibility for doing the home exercise program and the dilator work and using the pelvic wand, and that if you're coming to see me for an hour once a week or once every 2 weeks, that's just like allowing you to give you the space to work on yourself, and which I think is really critical.
Yes. So the self-care is part of it is in office with a practitioner. And then there's so much that you can do with home care as
Yeah, with
well,
the follow-up.
and making yourself a priority essentially. And this is so huge, especially for first time pregnant women, because once you have a child, it's much harder to practice self-care, although it's just as important
Yeah, exactly.
to schedule. But it definitely, I feel like what I like to share is if you haven't yet had a child, get these routines and habits created for your self-care now, because even though they'll have to be modified after the child is born, you're going to see that value and you're going to make it a priority.
Absolutely. And that's, one of the things I want to talk about today is like helping women helping women have the tools either before they get pregnant or while they're pregnant to really learn, have a baseline of what your body is doing, how you can create your self-care, how you can think about your strength, your mobility, and then use that to be proactive in your recovery.
Yeah, so let's talk a little bit about that.
All right. So, one of the things that I want to talk about is that, as a pelvic floor therapist, as a pelvic floor slash orthopedic neuromuscular therapist, the most common thing I hear when pregnant and postpartum women come for treatment is, how come no one tells me this could happen? So, which is very powerful. And then the second most common thing I hear when pregnant women come into my office with pelvic pain or lower back pain is, I told my birth provider that I was having these issues, and they told me, oh, just wait until you have the baby. You don't have to
Yes,
deal with it now.
I've heard that as
Just
well.
give it time. So, I mean, these are not very helpful statements. These are
And they're
not
quite
helpful
common
statements.
too, and
They're
they're not
super
helpful.
common.
They're disempowering, and it's really I think, and what and this I don't know if you agree with this, but I think part of it, if the birth provider is specifically a medical doctor, an OB, typically medical doctors first treatment is medication, right? And everybody knows you don't give pregnant women medication unless it's like absolutely necessary. So they kind of feel like, oh, there's nothing I can do to help this woman personally, so I'm just going to tell her, I'm sorry, you're going to have to wait until you give birth, and then you're probably going to feel better after the birth. But the truth is that by making a referral to a physical therapist, to a chiropractor, acupuncture, massage. I have all of that here in my office. That's so powerful. And I have a handful of OBs in the area that do that, but not every OB does. And so sadly, these women have to find out from the mom's Facebook group or their girlfriends that this is an option for them. And they're like, oh, I've been like suffering for a couple months and it's not getting better. And I don't want to wait until I give birth, or what happens after I give birth? Am I going to feel worse?
Right. And the big for me, the big issue is when if you're pregnant for the first time and you're experiencing, all these things we're talking about, pelvic girdle pain, or even the other things that are hormonally driven, the, crushing fatigue or the other physical changes, you really have no context for that. You've never experienced it before. So, when women say, how come no one told me this could happen? Because you're certainly, the providers are not telling you can happen. And I think um, it's again, because there's no context for what you are going to experience, it's hard to know the right questions to ask. So then you try, you finally, you ask, as you said, you go on Instagram, you ask friends, and you find your own providers, and you find the people who help you feel better. And then you're more in control of what's going on. You're more proactive. But the answer that you should just wait it out and, is absurd.
It is absurd. I'm
If
never a
it's
fan of wait and watch. Like when there's safe, non-invasive, effective treatments available. Wait and watch is if you're like, okay, should we do brain surgery or not? And it's like, well, let's wait and see if this growth gets bigger, right? Like that makes sense. But when we're talking about that something so safe during pregnancy, this is not going to hurt the baby, and it could really, really help the mother's experience during the pregnancy. And we know that the way the mom feels during pregnancy, her thoughts and her emotions, which it includes pain, right, creates biochemical changes that are experienced by the fetus. So we want moms to not only feel positive, we want them to feel good too, physically and emotionally during that pregnancy.
exactly. And I mean, the idea that you just give something time, I always think like, well, in my mind, I'm saying, you give it time, what, to continue being dysfunctional? So, so I think what's happened though, and I've noticed this, in my own practice, I mean, because at least 70% of my practice is self-referral. So, they hear these statements and then they're not satisfied and then they find their way to people like us and they get the treatment that they need and they deserve.
Yes, and I think I'd like to also follow up on what you're saying about like waiting to see if it gets better on its own. When it comes to pain specifically, let's say it's lower back pain, what I was taught in school is only 10% of the input into our spinal cord even registers in our head as pain. So our spinal cord is equipped to kind of quiet and suppress all of this input so that our brains aren't bombarded with information from our body and we can't function, right? So if something's even made it to your brain and you feel pain, that's your body really is crying for help. Like that is not normal and that's not okay. If you were taking, let's say, acetaminophen, that's just numbing the symptoms. It's not addressing the root cause. And eventually, I would say that sometimes the pain level can sometimes subside for some patients. It's not, but it doesn't mean that the problem is fixed, right? And so I think that's the other thing is like, okay, well, I'm feeling better, or it's getting a little bit, so I'm just not going to do anything. But most of the time, the healing is not optimal, and there's still dysfunction there. And then that also means that person's more prone to get re-injured or have it come back, right? It's like, oh, okay, a year later it came back, and then a year later it came back, and it's because the problem wasn't addressed, the root
Right.
cause.
Right. So one of the things that I'm thinking about in trying to kind of level the playing field for women is really starting to approach it from how can I or we help women prepare for pregnancy and the postpartum year by really upping our strength and our mobility and really understanding what's your baseline. So my idea is, to what I encourage is like, again, if you're thinking about that you're going to be trying to get pregnant, or maybe
Preconception.
preconception, or maybe in the second trimester, like, so you give yourself a little time and space because you might have nausea, you might not be able to work, all those things, is that coming in for a muscular skeletal evaluation so that you can really understand how your body works. So, a lot of women come in and they're already hypermobile. They have, but you can be hypermobile and still have stiffness, or you can have short muscles. Or so my idea is have a full muscular skeletal evaluation. Let's take a look. Is there hypermobility in your spine, in your hips, in your knees, in your elbows? Or are you stiff? Are you weak? And then have a plan of care. So these are the things, from my perspective, that will help you to get through your pregnancy, especially as you keep going through the trimesters and these hormone shifts increase and as your weight increases. So you have, and it's not like a long, involved exercise program, but like little bits of how do you strengthen, how do you stretch, how do you do mobility exercises, how do you prepare for labor and delivery, how do you, give them some tools for like immediately after postpartum, what is safe, what's available, and then you have some kind of structure about your own body, so you don't have to rely on someone saying, oh, that's, you could just wait for that, that's not important. That your body, this is how your body works, and this is what you can do to maintain and improve the fitness. And I just want to add one thing, is because I think that there's still this like really crazy misconception that like pregnant women shouldn't start a new exercise. Like, why are women that stupid that we can't figure out how to
Fragile,
exercise? Yeah,
delicate.
yeah, it's like that's ridiculous. Like, of course you're not going to go skydiving.
Right.
You're not going to go scuba diving. But if you
Skiing.
start, yeah, but if you pick up some light weights or some, resistance bands and start, like, that's okay. That's really safe. So that drives me crazy. So these are the things that I think could really empower our patients, our clients, to they have something that now is theirs because it's all based on the information about their body, and it gives them a whole different toolbox of things to work with. And that's what I'm so passionate about is like, again, help giving someone a really good evaluation, telling them what the objective findings are, looking at the plan of care, saying, here's how we can collaborate, and here's what you can do. And I think that that's a really different way of looking at it, because I think so many women are looking outside of themselves, because just there's so many people on Instagram selling their particular strengthening program, and people try it and then they might feel frustrated by it, or they feel like they can't keep up because their body wasn't evaluated. So I'm super excited about that idea, and that's something that I'm going to be implementing more and more, in the upcoming months,
I
as
love
part of my.
that. I mean, that's really just body awareness. And
Hmm.
optimally, we're all really in touch with our body and we really know what our normal is versus what is common or something we've been living with for years. Because sometimes people will come in and they'll be like, oh, yeah, I feel pretty good. And then I'm poking around and they're like, ow, ow. And they're like, oh, yeah, I'm like, that's been there a long time. That's not new. That is some stuck energy, stuck emotions. This is not optimal health or optimal function and mobility. And we can change it, but you have to know, you have to be conscious that things need to be changed and improved in order to make that happen. And knowing which exercises your body needs and what that looks like. And so I think, people, when I have women in my office that were athletes or have been working out for years, they tend to be pretty body aware. But and that helps during their pregnancy because they have that connection. But even if you weren't the most athletic child or person, you can still get body awareness through this hands-on body work where you have a skilled practitioner giving you feedback and you're learning what normal movement is for these different parts of your body. And if there's an area that's stuck, that is something that can be improved on. And so back to your preconception concept, that has been something I've been preaching for a long time. I people don't necessarily even know what preconception means. It means you're not actively trying yet, but you want to, let's say 6 months to a year from now, and you're really consciously improving your overall health and wellness. You're detoxing, you're cleaning up your lifestyle, your environmental exposure to toxins, and you're working with practitioners that are going to help you get that deeper level of body awareness before you even try to get pregnant. Because sometimes women are like, oh yeah, I think I'm just going to start trying next month, and it's like a very casual, like, oh, and it's almost like they don't want to commit to, well, if I can't get pregnant for several months, then I'm not going to be upset or hurt. Right. It's like very like, oh, if we get pregnant, great. We're not using protection, blah, blah, blah. But this can be very deliberate and conscious that you and your partner are like, yes, we're ready and we're going to do this as a team. And we both are prepared for this next stage of our life.
Yeah, I think that makes a lot of sense because, um, I think my philosophy is always be as healthy, as strong, as self-aware, as mobile as you can. Eat good food, do everything you need to do, because the reality is something might happen that's not so great for in your life. You can get sick, you can fall, you can have things happen, but if you have this deep reserve of strength and self-awareness and mobility, then you can be your best bouncing back from it. And I think that's true for pregnancy and fertility treatments and postpartum, all of those things. If you can have that awareness, if you really take the time to develop that skill, then I think it really works in your favor. And
Oh, I really
um,
appreciate that. That's powerful what you just said.
thank you. And what I see also, and what comes up for me too, because I am a pelvic floor expert, and and women come to me postpartum. Um, when I was listing like the most common things I hear with my postpartum patients, I feel that I often hear that they come after their 6 to 8 week visit with their doctor, and they're told that everything looks great and that they are their uterus is good, their vagina looks good, everything's good. So, go ahead and, let's talk about birth control and get back to sex and get back to exercise. But a lot of these women don't feel so great. They feel like they tell me they feel broken. They feel pressure. They're, losing urine. They're not able to sit. So, there's a real discrepancy in what they're experiencing, the questions that are not being asked. And then the way to deal with it is, have a glass of wine, or, you're fine. Just try to get back to what you're doing. And, I think the problem is, so a lot of OBs say that, and yet we know from pelvic pain physicians that it takes 3 to 6 months for women to feel back to normal. And yet, by telling someone at their 6 to 8 week post-op visit that everything's great, we put so much pressure on them. So then they think, well, something's really wrong with me because I can't have sex and I don't feel like exercising, or I can't take care of my baby. So like that playing field needs to be shored up quite a bit as well. And um,
Yeah, and I would say from a musculoskeletal perspective, what I saw with my own body and the women in my office, it takes about a year for the body to recover from pregnancy and birth. So beyond just the uterus and the vagina, what about the spine and the muscles and all the nutrients that went into our baby that were like refilling our bones and tissues? Like it's very intense to become a new mom. And it's important to be gentle and patient, that we don't have to rush to get back our pre-pregnancy body, so to speak. I think there's a lot of pressure with that on social media. And it's like, especially if you're not having a lot of help with childcare and you're exhausted, then, working out may not be the best thing for you right now because you're depleted and you don't have any reserve to do it. And you're going to potentially injure yourself too.
Right. And I think, well, that's why I agree 100% that it takes a year to really get back, if not
If
longer,
not longer.
if not longer. But you can do little things to help support your strength because parenting is so physical. So I remember when my son was born. I mean, I was swimming up until 2 days before he was born. But I would, he was a big baby. He was almost 9 pounds. So the lifting, he was nursing constantly, the holding, the rocking. I would wake up with my arms numb. I was exhausted. My shoulders were bent forward. So there's so much physicality that happens for parenting that even if you spend 5 minutes, using a resistance band, doing a couple things to that it's task specific. And I think that's, you could do that instead of thinking that you could put your running shoes on and go out
Yes.
for a run
Yes.
and then be disappointed in not feeling your best.
Right.
So,
So I
and
think
and
mobility, stretching, foam rolling, even maybe
yeah, oh,
some
definitely.
yoga. So I think the physical activity is important, but at a very low intensity and a
Yes,
very
because
gentle.
yes, and especially if you're breastfeeding, the potential for you having low energy availability is really great. Breastfeeding takes an enormous number of calories. Just parenting takes, so if you're not breastfeeding, still the exhaustion, the care, it's really exhausting. So I think a lot of women maybe don't eat enough in that early postpartum time, and that adds to their exhaustion.
Right.
So
Or not having
I
nutrient dense foods.
yes, exactly. So, really being prepared, like, so, there was something I saw recently, like, less worrying about like what the baby's nursery should look like, which is fun. It's totally fun to do that and to get clothes but maybe like have your meals already, prepped and in the freezer, or have a meal plan, or ask your, like, take the help that people are offering. Let them bring food to you. Let them help you, because the recovery for your well-being is so critical at that time.
Yeah, it's
So,
mothering the mother, right? Like for me, that
yeah,
was hiring a postpartum doula, because I just needed help with that. And some women might have a mother or mother-in-law that can come in and help. But if that's not available to you and you don't have that village, then you have to pay for it, and it's worth every single penny.
yeah. Yeah, it definitely takes a village. Not every family has a village, or even a partner, but whatever help you can get, and so again, I just kind of circle back to, if you have some reserve of strength that you can then, like, do a couple things to focus on, I think it can really make a difference in that early time.
Can we talk about a couple of these exercises that you would
Sure.
recommend for a new mom who just gave birth that's
Yes.
going to help? I would think,
Yes.
like you said, posture, holding, nursing, things to open up the shoulders.
Yes. Well, I mean, when I gave birth, I wasn't a pelvic floor physical therapist yet, but I knew a lot about core strength. So, um, so just doing, well, always starting with diaphragmatic breathing, because that will, as we talked about, it will just kind of help the sympathetic nervous system, and then it will also help to, um, you know, the the changes in the pressure system. So the pressure system from your glottis to your pelvic floor, that is so expanded during your pregnancy. Now you gave birth, and it's like, it's just kind of, everything is kind of back to it's not even really back to its normal length and tension, but it's kind of like a balloon that's deflated. So one of the first things you could do is use your breathing, do the diaphragmatic breathing, start to engage your deep transverse abdominals, your core muscles, because connecting that, and maybe, depending on what's happening as far as, if you're still bleeding, if you had a C-section, if you had vaginal, start to at least remember what your pelvic floor feels like. So just, it doesn't mean that you have to Kegel your way out of the delivery room or wherever you are, but just to start to have, if you already had that background, it makes such a difference when you give birth. So,
It's that muscle
starting
memory, right?
that muscle memory, exactly. And then, the core muscles are your breathing diaphragm, your pelvic floor, your transverse abdominals, and the multifidus, those little muscles in the back of your spine. So when you're sitting, when you're nursing, when, start to just do some core strengthening to try to engage that and feel like you're knitting everything together. And then you can start adding some, even if you're holding your baby, like, that's a little bit of a lift, or have some resistance bands where you're sitting and working on some shoulder strengthening, some, your biceps, like, just really simple things, your rotator cuff, um, just to start to engage that neuromuscular system, so that it remembers what it needs to do to give you stability. Because, as we said, all the things that you are doing, sitting and feeding, whether you're bottle feeding, nursing, chances are you're going to end up hunched over. You might be on a couch that's a little bit too soft and too many pillows, but you're exhausted. So, you try to do the work looking at it from an ergonomic point of view, as well as, a postural point of view, and, so just really simple things. And then, once you kind of get past the first couple of weeks, you can start adding some bridging, some leg strengthening. When you're picking up your baby, you're doing a squat. Like, squatting is very functional. So, start engaging your glute muscles and your quads and your hamstrings. Like it can be super simple,
Bringing
but
the
it can
belly
really,
button to your spine before
right, that's your
lifting your
transverse.
baby.
Exactly. All of those things to access your core strength and then do the functional things. But, I think I recognize that it's very hard because that layer of exhaustion kind of dampens down the whole experience. So again, it could be like little bits. It doesn't have to be this designated like even, 2 minutes or 1 minute, or, you don't have to say, okay, I'm going to spend 15 minutes until you're ready. And then when you're ready, you can really invest more time and effort into that. But circling back to the problem is that most women are not supported in by their birthing attendant in this 6 to 8 week period. So they go home, and then, unless they're with a midwife group who does see them at maybe the first week and 2 weeks, most women are not even seen until 6 weeks. And then, during COVID, so many women weren't even seen in person. So no one actually examined them. So that discrepancy between like this gigantic change that just happened to you, and now you're not even being, really evaluated, and you're not getting the support you need from the medical community in order to keep to feel that you can move forward with strength and with power.
Yes. And that, I'm glad you mentioned that there is a discrepancy between OB versus midwife care. And that I was just really happy to have a midwife as my birth provider who came to my house after, maybe on day 2 to check in. And then, like you said, a few days after that, like she checked in a few times those first few weeks after I gave birth at my home. And then at the 6 week postpartum checkup, I went to her home office, right? Because then I was like, okay, I can drive and do this now. And, not a big deal. But I mean, those first few days, nobody wants to necessarily leave their house. And it was just like that extra level of service, right? To have this home visit and, um, and just the care and support and just helping to like what's normal and what's not normal. And as a new mom, you're not always sure what normal is.
Well, it's a much more, the term biopsychosocial way of looking at things. So what you're describing is they were helping you, but they're also attending to your whole family because now you're a family. So that's a really different approach. And, for the most part, that's missing probably from, I don't know, at least 80% of women who give birth. So you're kind of, most women are just kind of left in the lurch. It's like, okay, I mean, I remember when I was home, I had a C-section, and my son, I called the lactation consultant. Like I had a phone call and she gave me some advice, and that helped me. Like that was great. But, you're kind of like juggling, like, oh my God, maybe I'm bleeding, or this hurts, or I can't nurse, or there's so much going on and there's so little support. So it's really important to, if you can get the best team in place, both, you know, while you're pregnant, knowing that you're going to need these services once you get home, or if you're home, or just after the baby's born. But to me, all of this fits together in the work that I do in trying to, with my passion for just trying to help women navigate this time in their life.
Totally. A recent podcast episode I did was all about gathering your optimal birth team. And that's kind of what we're just echoing is the power of that team and how collectively we're really here supporting not only the mom, but the whole family. I know in my office, I see dyads as soon as the woman gives birth, it's a vaginal delivery. She can come in, get care. And I recommend that we do a newborn check too, because the babies have stress on their spine and cranial alignment going through birth, whether it's cesarean or vaginal. Some births are more straining than others. but I just want to do a checkup and see how we can support any alignment issues so that baby's nervous system can work normally. And they can have, all they have to do is sleep, poop and pee and eat, right? And if there's any challenges in those areas, then there potentially is some nervous system stress and a lot alignment issues. So yeah, to me it's like, and then guess what? I mean, dads are like, hey, I need care too. I'm lifting all these heavy things because mom's not, and then their back is strained and they're sleep deprived. I saw a dad today who's in his paternity leave and the baby's 4 weeks. And I was like, that's great. I'm like, how many weeks of paternity leave you taking? He's like 8. He's an attorney.
Oh, that's
I was
amazing.
like, I don't know any dads that actually take the paternity leave they're given. He's like, how do they not? He's like, I'm exhausted. He's like, I can't function as an attorney right now.
That's amazing. Good for
It is.
him.
And I am applauding that because number one, physically, he needs that time off. And guess what? His wife is, and family is getting the support that they deserve as well.
Yeah, that's fabulous.
Yeah.
Um, yeah, most people, that's a very special situation. I think
It's not
um,
necessarily common, right?
it's not common, and not too many people can afford to do that. Maybe is it his law practice?
I don't think he's the owner actually,
Oh,
but it's
uh-huh.
obviously progressive Manhattan practice. And I would know that there's a lot of dads in my office that will have that type of paternity leave, but they don't take it because they get bullied by the other men in the office. Like, you didn't give birth. Why do you need 8 weeks of time off? It's like, listen, it's this dads are going through a lot of adjustments as well when the baby arrives. And I mean, how beautiful for a family to just be together for several weeks. I mean, I think that's amazing.
It is. It just adds a whole other level of support for
Yes.
the woman who just gave birth, for the baby, for the dad. But that probably happened a lot during COVID,
Yeah.
although so people were home. I
He
mean,
does work from home now too,
yeah,
which
yeah,
pre-COVID, he was, commuting 5 days a week. So there's a beauty, I think, with working from home and dads in general, even though they're working, they could pop in to help out and like this family that I'm speaking of, this is their second child. So they also have a toddler at home. So the more people around, even if dad is in between work meetings, just being physically there to throw in a load of laundry or
exactly.
take the toddler to preschool. All of these things are helpful for the
Yeah,
mom to be able to just heal and
right, because
rest.
it's
And
healing. Exactly.
yeah, just one less
Yeah,
activity that she has to do.
exactly.
Wonderful. Deborah, do you have any last thoughts you want to share? This time has flown by.
Oh, good. Just that, I mean, I've been talking about strengthening. I've been talking about like, when women come in and say, how did this happen? I think, I see all of this self-care that I think you're promoting as well. It's like the yin and yang. It's the soft and the hard. It's like doing the things that you can take control of for yourself. You know, the the healthy eating, the foam rolling, the meditation, the breathing, the stretching, the strengthening, the taking matters of your body into your hands. I think recovery starts with, you know, a woman's ability to say, this is my body, this is what I need to do, and I'm going to move forward with this. And I just try to promote that and support that in my work. And I know you do too.
Yeah. Oh, I love that. Well, thanks again for coming on and sharing your passion and wisdom.
Thank you so much, Laura, for this opportunity again.
Well, I hope you enjoyed this episode with Deborah. She is such a wealth of knowledge regarding women's health, especially pregnancy, birth, and postpartum related. And I really also appreciate her passion around empowering women to stand up for their rights for themselves and their babies during the perinatal phase, because I do feel like women are vulnerable and sensitive and can easily be manipulated with medical gaslighting. So it's important as women that we really recognize our options and have informed consent. So we really know what we're agreeing to and if that feels like it's the best option for ourselves and our families. And I also want to share that I'm so excited to announce that the drlaurabrayton.com/courses page is now live, and it has not only my preconception module of the Brayton birth method, I also have added a fertility ebook, as well as my pregnancy and birth documentary, and a 1-week environmental detox program as well. So if you're looking for more support, information, especially around preparing for pregnancy, check out my page, and I can't wait to hear what you think.